Well, hi, everybody, and thanks for joining us. My name is Greg Olson. I'm the director of the New York State Office for Aging. I'm very excited to have this dialogue today and to be joined by four good friends, colleagues, and leaders in New York State. And so before I introduce them, I just want to give a little bit of a context here. So a couple of years ago, one of the priorities of the governor is to make New York State.
Greg, I'm sorry. It didn't go through. Hold on 2 seconds, please.
No problem.
I'm going to put you all back in the waiting room. Facebook has changed how they do this. Yay. All right, hang on, guys. Sorry.
Well, hi, everybody. My name is Greg Olson. I'm the director of the New York State Office for Aging. I'm very excited to have this informational dialogue today with four good friends, colleagues, and leaders here in New York State. Governor Cuomo's vision for New York State is to be the healthiest state in the nation. And that's a pretty difficult charge that takes a lot of different agencies, both at the state and local level, private entities, foundations, and the general public. And so we're here today to kind of talk a little bit about that and how we get there. So the state's roadmap is the prevention agenda. And some of our guests will talk about that a little bit more, so I'm not going to get into detail. But that's the roadmap to become the healthiest state that we can possibly be. As many of you know, we were the first state in the nation to be designated as an age-friendly state and have been working very hard to work with counties and other municipalities to get them to be age-friendly as well as standing up some age-friendly technical resource centers of excellence around the state. Governor Cuomo memorialized many of the elements of age-friendly and livable communities and smart growth in Executive Order 190, and that really directs states, agencies like mine and others to build some of these elements into our state plans and to provide opportunities through money distribution or procurement to address many of these elements. But this last piece that we're going to talk about today is something you may or may not have heard before, a fairly new concept called age-friendly health systems. Now, each one of these pieces that I talked about is not an individual piece. These are policies that, when knitted together and built together, will help our communities be great places to grow up and grow old, regardless of age, ability, income, and so forth. So I'm so pleased to have this really exceptional panel of folks that I've known for many years be here with me today. So let me first introduce Nora OBrien-Suric. She is the president of the Health Foundation of Western and Central New York. She has over 20 years of experience in philanthropy, both working at the John A. Hartford Foundation and the Brookdale Foundation. She also, in her earlier career, worked for the largest AAA in the country, which is the Department for Aging, DFTA in New York City, and as serving for the Director of National and International Partnerships at the International Longevity Center Global Alliance, helped pen and author the United Nations International Plan on Action on Aging in 2002. She holds a doctorate degree in social welfare from Hunter College School of Social Work, a master's degree in gerontology from the California State University at Dominguez Hill, and a certificate in geriatric mental health counseling from the University of Southern California Davis School. So we're super glad that you're here, Nora. Next is Charlie Williams. He works for the Department of Health within the Center of Healthcare Policy and Resource Development on the Aging and Long-Term Care team. The Aging and Long-Term Care team works to improve the state's long-term care system and provides older adults and caregivers services and supports responsive to their needs. This includes the department's work on the Health Across All Policies, Age-Friendly New York initiative with coordination with representatives on the HAP steering committee. Charlie has a bachelor's degree from Binghamton University and obtained his JD from the University of Western New England. So I'm glad to have you here, Charlie. Next is Dora Fisher. She is the Director of Post-Acute and Continuing Care at the Healthcare Association of New York State, or HANES. She has 15 years of experience in public health and aging, and originally had worked in my office with me at NYSOFA. So we're glad that she
best job I ever had, Greg.
Is at HANES. Glad that you say that. She holds a master's of public health degree and also has worked in research, advocacy, and state government, all with a focus on older adults and long-term care services and supports. She is most passionate about strengthening the pathways between healthcare and community-based services for older adults. And last but certainly not least is Lindsay Goldman. She's the founding director of the Center for Healthy Aging at the New York Academy of Medicine. She draws on 16 years of experience in program development, administration, direct service, philanthropy, and public policy. Specializing in public-private partnerships to create age-inclusive environments, Lindsay oversees a portfolio that includes Age-Friendly New York City, Health and Age Across All Policies New York State, The Image, the interactive map on aging, and unfortunately for all of us here in New York and working with her directly, on January 1st, she will take on a new position, and we're really proud of you actually, Lindsay, and will be the new CEO of Grantmakers in Aging, which is a national organization representing philanthropy. She holds an MSW from NYU and a BA from Wesleyan University. So an amazing group of 4 individuals. So let's get right to it, all right? Dora, what is age-friendly health systems?
Well, I'm so glad you asked, Greg. And also, thank you so much for having me. I have been watching these NYSOFA Facebook Lives since the beginning of the pandemic, and I got to tell you, you guys do an awesome job. And I'm so excited that I get to be on one now. So just to start out, I'll tell you all a little bit about what age-friendly health systems is. So it's an initiative created by the Institute for Healthcare Improvement and the John A. Hartford Foundation. And they created this framework for reimagining how care is delivered to older adults. And it's important to understand that this isn't just some standalone program. I think all of us who work in this field, you know, you've experienced it where you go through a training and you sign the paperwork and then you just go about your business. This is different. It's really about reimagining, reorienting, reorganizing how we approach care for older adults. So this framework focuses on 4 M's, which is very catchy and easy to remember. So the 4 M's are mobility, mentation, medication, and most importantly, what matters to the older adults. So just as an example, if an older adult is prescribed medication for a condition, is that medication being prescribed just because it's the best medication for the disease? Or what if that medication makes you fuzzy-brained and that older adult, you know, really cares about staying super sharp for their debates with their friends, right? I mean, so the idea of this is to think of these 4 M's in concert with each other and have all 4 of them considered every time an older adult interacts with the healthcare system. So fortunately in New York State, we have such a phenomenal healthcare system. We have so many great hospitals and healthcare facilities. And so when you think about these 4 M's, you might think, well, I'm sure my provider knows about all 4 of these and thinks all 4 of these are important. And that is definitely true. So it's not necessarily about brand new concepts. Rather, it's about, you know, having them working in concert. And so let me give you another example. I'm going to read something if that's okay. An older adult in my life sent me this email about a recent hospitalization she experienced. And this person is not in New York, but, you know, it's an experience that I think many could relate to. I have arthritis, and if I don't move around, my body hurts. And the more I am stuck in one position, the more I hurt. If I can do some minimal stretching, it really hurts much less. So one time I was hospitalized, and I was tethered to an IV, and I wasn't allowed to move. There was a nurse who was checking on me constantly, and if that nurse could have just helped me do a little bit of stretching, I would have been so much more comfortable. So that's probably a familiar story to many of you. And so the idea here is not necessarily that nurse probably knows that mobility is important, and that nurse probably knows that, you know, it's important to think about what matters to that individual. But the system wasn't really organized for that, for the needs of that patient to be thought of immediately in that way. And so if that health system had been an age-friendly health system, if they'd gone through this process, the nurse would have received training in the 4 M's and their interdependent nature, and the system would be in place to check in with the patient immediately about her needs. So that's essentially what the 4 M's is. That's what age-friendly health systems is. And it's a 7-month collaborative learning process for healthcare systems with webinars and events and conversations with experts and a lot of iterative quality improvement programming. So I'll stop there, but that's the overview of what age-friendly health systems is.
Yeah, and I think this is real exciting, and all 4 of you are involved in this effort in New York State. And what I really like about it is, you know, it comes from where many of us have been. Person-centered approach. It's looking at delivering healthcare from a different lens, which starts with the individual and kind of works itself backwards. So I appreciate that. So Charlie, how does the prevention agenda, which I mentioned a little bit earlier, and New York's age-friendly approach, how do these things relate?
Well, first, Greg, I just wanted to say thanks for inviting me to be here, and to everybody listening in to join us for today. I think the conversation is timely. The pandemic and its response has brought attention to the importance of addressing disparities and protecting our most vulnerable populations. This age-friendly and healthy aging work at both the state and local levels goes a long way to addressing this and sets the stage for that. But back to your question. The prevention agenda is New York State's health improvement plan. As you mentioned earlier, it's essentially the state's blueprint or roadmap for state and local action that can be used to improve the health and well-being of all New Yorkers. The goal of the prevention agenda is to promote health equity across populations who experience disparities. Like I said, it's our lens for the department to participate in the directives under the age-friendly executive order that you mentioned, which calls on all government agencies to collaborate and consider how their work impacts individual and community health across their lifespan. It was developed in partnership with more than 100 organizations across the state and is updated every 5 years by the New York State Public Health and Health Planning Council. This year's prevention agenda is it's a 5-year cycle, like I said, and the 3rd iteration, and was developed with the health across all policies approach in mind, and embeds healthy aging and age-friendly targets and measures throughout the 5 topic areas. They are prevent chronic disease, promote a healthy and safe environment, promote healthy women, infants, and children, promote well-being and prevent mental and substance use disorders, and prevent communicable diseases. The topics and targets within align with the goals of the age-friendly approach by promoting care and services for older adults and to seek improvement across the lifespan by addressing social determinants. They are the results of a comprehensive statewide assessment of health status and health disparities, changing demographics, and underlying causes of death and disease in New York. We've also used the county health rankings as a framework for understanding the modifiable determinants of health. And new to this iteration, as I mentioned, has been the incorporation of the health across all policies approach, which provides focus areas and measures embracing healthy aging interventions and including information that can help providers, communities, and policymakers identify areas to focus and strengthen their service delivery policies and programs on through the prevention agenda dashboard.
Yeah, so what you're saying is there's a lot of data and metrics out there to see how we're doing, and it's an all hands on deck effort. You know, in all of our business, right, there's all these acronyms, there's all these things that we talk about that kind of we know because we do this every day. The health across all policies approach is really about, again, backing up what you're saying, is, you know, all agencies and entities have a role and a potential responsibility in trying to improve health. So whether it's, you know, the things we already know, like transportation, but how important it is to be able to access a trail or a park, and housing and all the different agencies. And so when you say health across all policies, it's really about multi-systems engagement so that we're all kind of rowing in the same direction. So can you say a little bit about how the Health Across All Policies approach relates to the this new thing, this age-friendly health systems?
Right. As you mentioned, under the age-friendly Executive Order 190, the goal for Health Across All Policies is to embed age-friendly and healthy aging concerns into all facets of governance across all agencies, including contracting, procurement, policy development, and trickle down through every jurisdiction or topic that all the agencies cover. The work and approach have brought together traditionally siloed agencies to collaborate and develop a working relationship to help focus our attention on how each agency's actions and policies can help improve individual and community health, identify ways for us to collaborate, bring together policymakers, and develop a comprehensive plan and strategy, and then execute that strategy. The Health Across All Policies approach has helped to focus efforts on addressing social determinants of health. And it should be noted that New York's approach is somewhat unique among the other states that have used a similar health in all policies approach, in that New York emphasizes healthy aging across the lifespan and actively promotes community engagement and collaboration with our local government partners in the development and implementation of programs. Many other states don't necessarily have the same lens for older adults that we do, and some have a trickle up effect, where they're mostly driven by their counties. Our state has really concentrated a lot of the efforts at the executive level, and we collaborate with our county partners. That's evidenced by the age-friendly health systems work and the age-friendly planning grant, which have provided technical assistance and support to develop Health Across All Policies approaches at the local level and within health systems, and have communities become certified as age-friendly communities by AARP. These initiatives are an extension of the Health Across All Policies approach, for lack of a better term. The department is thankful to our committed partners, like my colleagues here today, in this effort to embed healthy aging and age-friendly principles into the delivery of health services. Our partnerships and work with the Healthcare Association of New York State, the New York Academy of Medicine, Trust for America's Health, the Institute for Healthcare Improvement, Hartford Foundation, and considerable support from statewide and local foundations like the New York State Health Foundation for Western and Central New York, and the Fan Fox and Leslie R. Samuels Foundation have allowed New York to really be on the forefront of these age-friendly efforts and reach a wide range of providers and partners to adopt and adapt care delivery and develop programs to work collaboratively in addressing social determinants of health and improving the health of our communities.
Yeah, and I think you mentioned something really important. The best way to make systemic change is to institutionalize some of these things and how government and private-public partnerships work. And just describing all the partners that you mentioned that are both within and outside government, and how you build these things into how we operationalize what we do, is how you make systemic, long-standing change. And that's why I'm so impressed with what New York has been able to do, because it took that high-level approach from the governor's vision and then really built these pieces into how we work. So Lindsay, you guys were way ahead of your time, and part of your portfolio was building age-friendly New York City, right? And you've been a part of that since the get-go. So where do age-friendly health systems fit into local implementation of health and age across all policies?
Well, Greg, first, thanks so much for inviting me to be part of this today. Health and Age in All Policies is one of my favorite initiatives that I've had the opportunity to work on over the last several years. And at its core, Health and Age in All Policies is a strategy to improve population health by creating inclusive environments that enable people of all ages to engage socially, to be physically active, and to contribute to their communities as workers, volunteers, and consumers. So really, we're working to keep people out of costly, acute, and long-term care settings. But the reality is that as we age, we do interact with health systems more frequently. And so Terry Fulmer of the John A. Hartford Foundation often says that we really can't have age-friendly communities without age-friendly health systems. And she's right. We need to consider what happens and what matters to people both inside and outside of the health system. So we need to work towards optimizing both quality of life and quality of care. And health systems can play a really important role in helping us get there, because they're often anchor institutions with significant economic, intellectual, and human capital that can be harnessed to improve population health, to reduce health disparities, and to strengthen neighborhoods. So, for example, many are required to invest community benefit dollars and conduct community health needs assessments that can both be used to advance age-friendly initiatives.
Yeah, I think that's exactly right. And one of the reasons that I'm so excited to be a part of this in whatever capacity we can be supportive is exactly your point. People are interacting with the health system and then they go home and they need supports, and there needs to be the interconnectivity, and people need to know what to expect in the health system, and the health systems know what they can expect outside, so that again we're all kind of on the same page. And Nora, I know this is really near and dear to your heart, both in terms of your current work at the foundation, but really over your history, both working for the John A. Hartford Foundation, but many others. So from your perspective, what role does the Health Foundation have in this initiative, and why is this initiative important to your foundation? There you go.
Thank you, Greg. And I'd also like to echo everyone else on the panel, my colleagues and partners in a lot of initiatives. It's really a pleasure and a privilege to be on this. And so thank you for hosting this and inviting me to participate. The Health Foundation is really proud to be a partner in this initiative. So Health Foundation of Western and Central New York, our vision is a healthy Western and Central New York where all people, especially racially marginalized and or economically disadvantaged, can reach their full potential and achieve equitable health outcomes. And that's our vision. And we focus on the most vulnerable of our populations, which is older adults and children who are impacted by poverty. So this initiative is really near and dear to our work because it is focusing on older adults and especially on the healthcare for older adults. And as what Dora has said and what everyone else has said, health inside the institutions of, health clinics, hospitals is so important to make sure that we get this right, that older adults receive the best geriatric care possible. And we know, the John A. Hartford Foundation has provided, over $500 million over 30 years to really develop more than 24 best practice models in geriatric care. And so this is a way to be able to bring that knowledge really out into practice. So the Health Foundation, focusing on the 16 counties in Western and Central New York, but we know we need to partner with all of the statewide organizations in order to be able to have an impact. So we're really pleased to be able to support this initiative through grant funding that is going to the Haney's. We're also supporting the age-friendly communities with NYSOLFA and Smart Growth, and our partner there is with the Department of Health with Charlie, and we're funding the New York Academy of Medicine as well in that. So Lindsay's been a partner. So the Health Foundation is really pleased that we're launching this year, age-friendly health system. We also believe that health happens at home, so helping the health systems understand what's important to older adults and their caregivers and bring that into the community, and helping the community also be strengthened in order to be age-friendly and to work hand in hand with all the health systems.
Yeah, that's great, Nora. And I remember hearing you do a presentation on this a while back, and this was kind of when I had first heard about it. So, you had mentioned that, other foundations are involved. Charlie had mentioned some of the others as well. I mean, this is a high stakes thing at this point. How does a collaboration like that, evolve or get off the ground?
Yeah, it's a wonderful question. So it's, obviously foundations have their own mission. But when we find other foundations that have a similar mission, and we do that actually through the Grant Makers in Aging, we're able to find our partners there. And so we know that, the Samuels Foundation, as Charlie mentioned, and the New York State Health Foundation are also interested in improving healthcare in older adults. So actually about a couple of years ago, when the John A. Hartford Foundation actually convened foundations on the East Coast in Baltimore is where we met at the Health Services Research Administration to really talk about the 4Ms, age-friendly, what this means, and looking for foundations to help support the action communities. And so at that time, those of us who were in the room, and we were all in the room, all of the partners were in that room, said, you know, what can we do in New York State to come together to do this? And because of Governor Cuomo's wonderful mandate, which we know is unfunded, to make New York State, you know, the healthiest state and to be the first action community, statewide action community in age-friendly health systems, as well as the first age-friendly community state. Really proud to be part of New York State in this initiative. So at that time, so it was 2 years ago, and it really took us a while to say, how are we going to work together? What do we want to see happen? How do we partner with the New York State Office for the Aging and the Department of Health, which were both leaders in, and then bringing the other foundations to the table. And it was so easy at that point because everybody is so interested in working collaboratively. And it was just wonderful when the Haney stepped forward and said that they would be the recipient of the grant funds and they would take the lead on this, and made it very easy for all of us to be able to come together to fund this. So it's been a wonderful partnership. I really want to give a shout out to the Samuels Foundation and the New York State Health Foundation for really being great partners in this.
No, and I thank you. And, you know, what people don't know is how much we all collectively do together. Our other partner in crime is Paul Byer. So I'm just going to give him a shout out. But, you know, I think to your larger message, you know, there's a lot of very caring, compassionate people that understand there's a lot of work to be done. There's a lot of assets. And if we pull ourselves together, you know, we can accomplish a lot. No one entity or organization can do anything on their own. And so these collaborations are so critical. So Lindsay, back to you. What is the role of a backbone organization like the New York Academy of Medicine and Haney's, and Dora certainly can weigh in on this as well, in rolling out, scaling up, and sustaining age-friendly initiatives?
So I think that the role of backbone organizations like ours is to coordinate age-friendly community planning and clinical practice efforts to ensure that we're really working collaboratively. We don't want to be running on parallel tracks. We don't want to be creating new silos. We're really striving for integration. And so as backbone organizations, we work to connect the dots, and we do that at multiple levels and across sectors. So for example, we had one area agency on aging that was having trouble engaging their local planning department in their age-friendly community initiative. And you mentioned Paul Byer. Well, we were able to serve as a bridge to the Department of State, and Paul made one call and got that planning department to the table. So I think that, you know, the New York Academy of Medicine and Haney's bring decades of experience in implementing policy and practice change. And we're drawing on that experience using a learning collaborative approach, which you mentioned. And those learning collaboratives really bring people together to redesign health systems and communities to become more person-centered and efficient. And I'll just give a shout out to all 16 of the counties that we've been working with over the last year. Learning collaboratives allow people from different institutions and locations to share their experiences and best practices in implementing new models. And maybe most interesting, once participants are more comfortable with each other, they can share what hasn't worked. And that can be really valuable, because if I've already made a mistake, maybe I can save you from expending the same time, money, and energy. And learning collaboratives like the ones we're facilitating are particularly well suited for our current virtual environment because they can be done online. And they've really enabled us to build a community of practice, of stakeholders who are all working together towards the same goal of the healthiest New York State.
That's great. And, you know, many of the projects that we're working on in this space would not, we couldn't accomplish them without Haney's and without NIAM and without, you know, Nora's organization. So they are critical. If there's any background noise or I'm grimacing, it's because my dog is either attacking me or in the garbage, my new puppy. So please bear with us. I apologize. Dora, let's go back to you. Tell us how Haney's got involved in this. And, you know, your organization is critically important on the health system side to really make this happen.
Oh, thank you, Greg. And yes, I agree with a lot of what Lindsay shared about the nature of organizations like ours. So just as a bit of background, the Healthcare Association of New York State, we represent hospitals, health systems, continuing care providers, all across the state. Our members are in New York City and Long Island, the Adirondacks, Western New York, everywhere in between. And when our governor, as Charlie and Greg and others have discussed already, our governor has the directive of 50% of health systems to be age-friendly by 2023. We were so pleased when we started talking to the health department about this and to other partners about this. And that's when the Health Foundation of Western and Central New York and the New York State Health Foundation and the Samuels Foundation came in. And I just have to say, it has been the most amazing collaboration, just like Nora said, you know, having us all come together and promoting this amazing project and putting on this amazing project. And, you know, at Haney's, it really is a natural fit because what we do for our members is we provide a lot of continuing education, a lot of technical support, a lot of learning collaboratives and opportunities to connect with each other. And we really do serve as a hub for our members in that way. So when we started learning about this initiative, it just seemed like such a great fit for what we do and for what our excellent members are out there already doing as well.
Sorry about that. Thanks a lot, Dora. I appreciate that. And again, the involvement and the you know, folks taking this on, I think you are way beyond what you thought in terms of the health systems that wanted to be a part of this, that really show the interest, which I think is amazing. So Nora, let's go back to you. Are there other states that are also investing in the age-friendly health system, and are their goals similar to what we're trying to do here in New York?
There are other states that are involved in the age-friendly health systems across the country, but New York State is very unique because we are actually focusing on being an action community statewide. So the John A. Hartford Foundation and IHI are focusing on action communities across the country, and they actually have a call out for more training in this spring to create action communities. And really, it's just a cohort of health systems, health clinics across the country to come together and to learn from each other. You know, as Lindsay said, you know, having these kind of cohorts come together, you really learn from each other and carry learnings forward and try not to make each other's mistakes. But so we're really unique. There are other foundations that are supporting this across the country, but here in New York State, where we really come together to really focus on the statewide initiative, I think is really unique. And we did mention the three of us foundations that are working, but I'd really like to also point out that, you know, obviously the Health Foundation, we focus on 16 counties, so 2 regions, and we're really mandated just to make sure that everyone in those populations are benefiting from any programs that we support. But in order to do something statewide, we need to work statewide as well. So we have the partnerships with the departments here, but the New York State Health Foundation can fund statewide. So it's just wonderful to have a state or foundation come forward. And then the Fan Fox and Leslie R. Samuels Foundation, which focuses more on the city and downstate, you know, so they can cover that. So really, it's just a wonderful, unique blend of local, state, regional, and national, because the John A. Hartford Foundation is a national foundation, to all come together to really look how we can take something that's happening nationwide, but how we can really work more locally with the State Office for the Aging, the Department of Health, and with the Haney's and with NIAM to really find what makes us so unique and how we can work at the local level to really embed this, because that's really the most important thing. And that's the goal. You know, our goal is 20%. We hope that we'd like to see 100%, but we're going to build on that. But that's the goal of the John A. Hartford Foundation, that 20% of the health systems and healthcare across the country will be age-free. I'm just really happy to make New York State to be the first one to really put that in statewide action plan.
I know, that is so exciting. It really is. Thank you. Dora, I'm going to ask you 2 questions, and then I'll come back quickly here. What has been the response of the health systems? Because again, this isn't something people are required to do. This is something they have to volunteer to do, is question number 1. So what has the response of those health systems been, and how can other health systems join if they're interested?
Thank you so much, Greg. And you're not kidding. We were really wondering what the response would be like. I mean, first of all, it's very clearly an amazing program or amazing initiative, and everyone involved feels that way, and people who've done it feel that way. However, we had planned to launch this in April, and I'm sure everyone can imagine that we needed to adjust our plans. And so we shifted our timeline a bit. We weren't sure what the response would be, given that everything that New York State health systems have been through. One thing we found, we were really pleasantly surprised. We found that everyone is really excited to focus on a brighter future. And I think that the pandemic has really thrown into sharp relief that high quality, person-centered care for older adults has just never been more important. So the response has been really positive. I think that everyone is really happy to be a part of, building something together and reframing how they approach older adults. I also want to add that I think our health systems are really excited to collaborate with the Aging Network because, and Greg knows that I've been beating this drum a long time with every time I go out to our members, I put a little bit of a nice sofa hat on and I say, hey, do you talk to your community-based aging services? Do you know who your director of your Office for the Aging is? And they always say that they do, and they're excited to connect with them and work with them. But one thing that we want to do as part of age-friendly health systems is really integrate that in a more formal and sustainable way. We want, when older adults are discharged from the hospital, we want to make sure that these systems that often, unfortunately, run on parallel tracks, we want to make sure that they work together to make sure that the transition between being in a hospital setting and being in a community-based setting involves great services and supports on all sides of it. So I think there's just a lot of excitement all around. And Greg asked how to get involved. And one of the ways that we changed the project timeline because of the pandemic, we split into 2 cohorts because we wanted to give ample opportunity for our member healthcare systems to say, okay, well, our COVID numbers are really low right now, so I think we can start to do this, or we want to wait 4 months and do it later. So we call them upstate and downstate, but it's really anyone can join either cohort. And we have an upstate one that just started in November, and our second cohort starts in February. And so we are still recruiting health systems to participate. We're going to put some links in the chat you can go to haney's.org/age-friendly, and the link will be in the chat. And then we also have a more detailed, if you really want to dive in, we have a detailed PDF with everything you need to know before you sign up. So I definitely encourage you to take a look at it. If there's any older adults in the audience or caregivers, feel free to send it to your healthcare providers and express your interest in having your system participate. I think it's a really great opportunity.
Yeah.
That is. Thanks, thanks, Dora. Yeah, go ahead, Nora.
If I may just jump in, because Dora said something that I really love, about the partnerships between health systems and the community-based organizations. This is so important to have these collaborations. And the Health Foundations, one of our goals in our new strategic plan is to help strengthen the collaborations, to provide incentives for community-based organizations to partner with health systems, and then, to help them strengthen that and sustainability. We have a wonderful example in the Western New York Integrated Care Collaborative here in Buffalo, which has been in operation for almost 10 years now. And it's just a wonderful success in a consortium of community-based organizations working with health plans and health systems in making sure that the older people in the community are receiving the best benefits that they can in order to remain healthy and independent for as long as possible in the community. So Dora, we probably have more conversations that we can have in order to see how we can just strengthen this vision that we both have. Thank you.
Yeah, and how all that gets tied back to the prevention agenda and addressing the social determinants, because that's what those community-based organizations do so very well, that complement what clinical care does, and you can't have one without the other if you really want to serve people the best way possible and have the best outcomes. So you're right. So Charlie, I'm going to wrap it up with you. You talked a little bit about data earlier. What are some of the resources that can be used to track progress and gain insight on community health issues and the potential actions to take to address any issues or disparities?
Right. All right. There's a couple of resources that I have found especially useful in identifying program areas and evaluating the impact of the state's age-friendly initiatives. First is the Prevention Agenda Dashboard, which is on the department's website. It allows for tracking progress and on addressing the prevention agenda priorities, as well as contains links to information and resources on the target and focus areas within each of the 5 priorities. Each priority also has a specific action plan that includes goals, objectives, and measures for evidence-based interventions that can help to track and measure impact. The information in these action plans provides communities or those interested In learning more with recommended evidence-based interventions, promising practices, and guidance, it also highlights organizations that are undertaking this work and are well placed to take a leading or supporting role in an effort to promote partnerships and collaboration. Another is the department's county health indicators by race and ethnicity, or CHIRE dashboard. The dashboard is operated by the Office of Minority Health and Health Disparities Prevention within the department. They analyze and disseminate data on the status of minority subgroups in New York. It's routinely updated and posted to the dashboard page and is produced in an annual report on minority health. It provides a way for the state and local governments to identify disparities in their communities, and can also provide a comprehensive summary of health metrics that can be broken down by county to allow for measurement and assist with tracking and identifying issues, especially those that impact minority communities. The hope is that the information on the dashboard can assist local health departments and health service providers with the resources for them to design and evaluate interventions that can reduce health disparities. And finally, and lastly, so I don't just trumpet the department's resources, the AARP age-friendly website provides numerous resources on what constitutes an age-friendly community, potential interventions and programs that can support or achieve that designation, and tools to help evaluate progress on implementing age-friendly initiatives. Their evaluation guide has been especially helpful to me to lay out ways to provide evidence and track what is working and what could be done better within the state's effort.
Yeah, great. Thanks, Charlie. And I believe the resources that you cited, as well as really all four of you, are either in the chat box now for people to link, or we will make sure that they are in the chat box when we come to post this. So this was just a teaser of things to come. I would love to have, I'd love to have all four of you back. I'm not quite sure Lindsay will be able to do that, but you never know. We'll see. But I think we have, you know, there's some updates I think are going to be really important as this rollout comes in that I would love to get everybody back together. So I can't thank you enough, Charlie, Nora, Dora, and I saved you last, Lindsay, because we're going to miss you in your role at 9 a.m. But I'm absolutely thrilled that you'll be moving on to Grant Makers and Aging, and you know, we'll continue this work together. I want to thank Kelly Matija, as I always do, our communications director, who does all the behind the scenes work to make these things happen. They just make us look good, and you know, all the technical stuff that I don't understand, she gets done. We're going to be taking a couple of weeks break for our next Facebook Live. Will be on January 14th, and I'm really pleased to have Judith Weinstock from the Security and Exchange Commission, who's going to talk a little bit about financial literacy and scam mitigation in terms of, you know, what we were seeing pre-COVID, but certainly things that we're seeing now, especially on investor and investment fraud. I'm going to leave you with this. As Governor Cuomo said, we are now in the most social time of the year. It is heartbreaking after 11 months to see that we lost 3,100 people yesterday, the highest toll during this pandemic, and we are a ways away from getting out of this. So, you know, we're a couple of weeks away from Christmas. Please, and New Year's, please take the protocols seriously. You know, the life you may protect may not only be your own, but somebody that you love. Wear a mask, social distance, practice good hand hygiene, and please be safe. And when the vaccine becomes available, take the vaccine. It will be safe, it will be effective, it will been reviewed by 3 different entities, including New York State. So I want to thank you all again for joining us and my amazing panel here, friends and colleagues. Thank you all, and happy holidays to everybody.
Thank you.
Holidays.